Thank you, Julie. It's so great to be here. Um, yeah, you gave a great introduction. I don't think I have anything to add. I'm just really grateful for the opportunity, and thank you, everyone who's here tuning in, and for everyone who's going to watch later. So I'll go ahead and get started. So I want to start by just kind of looking at what our modern death culture looks like. And to do that, we'll take a few steps back in time and just kind of look at how death and dying has unfolded in our country leading up to the present day. And I have some notes here on my right, so I might be shifting my eyes over there. That's what I'm looking at. So in the early 19th century to about 1860, dying occurred in the home. And dying people were cared for by family members and community members. People knew how to tend to their loved ones, and burials occurred usually just right outside the home, or at the local farm or in the churchyard. So dying was really integrated as kind of just a normal part of life. And then the Civil War happened around 1861, and families were demanding that loved ones who died in battle return home for burial. And that's where we see the birth of all these embalming practices. So embalming is when the fluid from the body is removed and then it's replaced with chemical preservatives. And this made sense at the time because bodies were being transported from the battlefield. They were taking a long train ride back home, and so they needed to be preserved. So that's where we see the birth of this embalming practice. And then the local craftsmen began making coffins. And this combination is where we kind of see the birth of the undertaker trade. And undertakers are modern day funeral directors. Kind of around the same time, or no, a little bit, a few years after, we're starting to see more public hospitals pop up in urban areas. And there's also the development of germ theory. So germ theory states that there are certain bacteria and pathogens that cause illness. And dead bodies were seen as harmful. It became a public health issue to have dead bodies around because they were seen as contributing to illness and disease, and people were no longer handling deceased bodies anymore like they used to. They were no longer, burying them in the local the farm or the churchyard because it was seen as harmful and dangerous. So there was really a lot of public health rhetoric around dead bodies being infectious. And so that kind of contributed to removing the death and dying process from communities and into these more kind of urban settings where there was access to public hospitals. So really by the end of the 19th century, deaths, especially in urban areas, were very industrialized, and most people were dying in public hospitals. And that's kind of what we're still seeing to this day. Stanford Palliative Care recently, within the last 10 years, did a study asking people about their end-of-life wishes and where they wanted to die. And they found that 80% of Americans would prefer to die at home. However, only 20% actually do. Another 20% die in nursing homes, and the remaining percentage die in the acute care setting, so like the hospital. So that's a pretty big gap. 80% of Americans saying they want to die at home, but only 20% actually do. So that kind of begs the question, like, why? Why aren't people able to live out their end of life wishes? It's a complicated question and it's a complicated answer. But, you know, I think we all are probably pretty aware that death phobia is pretty prevalent in our culture. We don't like to talk about death. We don't like to think about death. I mean, maybe some of us here are a little more comfortable engaging with this topic, but just kind of generally in our American society, yeah, we don't like to talk about it. We don't like to think about it. And we're often not engaging with it until it's, you know, right in front of our face, and we're either ourselves, you know, we're facing a terminal illness or a life-limiting illness, or our loved one is at the end of their life. And because we're not prepared for it, because we're not engaging with it early on, it's extremely overwhelming. There's a lot of anxiety, there's a lot of fear, you know, and then the spiritual landscape in our culture is very, I guess we don't have one kind of spiritual foundation that we're kind of using to navigate these existential experiences. And so that, of course, contributes to a lot of fear and anxiety. So again, it's very complicated, but I think the point that I want to make is that death phobia is quite prevalent. And another interesting component of our modern death culture is, I don't know if anyone has read the book, The Denial of Death, or is familiar with Ernest Becker, but he proposed that our fear of death is the dominant driver of culture and religion and human behavior. And so we, because of this fear of death, create systems of order and hierarchy and control. And it seems like a very natural response, right? We are animals. We have this biological primal drive for survival, and yet we have the conscious awareness that we will die, that we will not survive. And so how do we reconcile that? How do we reckon with that? And Ernest Becker says it's by creating systems of order and control. And if we look at our culture, American culture, and especially like with healthcare, you know, healthcare is very rigid and controlled, and it needs to be for a lot of reasons. But when it comes to end of life, which is a very sacred experience, it doesn't always feel it doesn't always feel great to, be dying in these systems that we've created. Because ultimately the systems that we live in are the ones that we die in. And another point, we live in a very individualistic culture. There's not a whole lot of community experience anymore. And so we also don't live in like a deep connection to the natural world. So all of these things kind of prevent us from engaging with the end of life as this kind of natural, communal, supportive experience. We're expected to do everything on our own. We're not expected to ask for help. And facing the end of life with this sort of perspective and attitude makes it even more overwhelming and kind of full of anxiety. So we'll get positive soon. But just to kind of be real about, the kind of culture that we're living in, and also conversations around death and dying are not normalized, and families and loved ones are left feeling really unprepared. Also, death comes later in life than it has ever before. So a lot of adults are going their whole life without really being exposed to family members or friends dying. We also prolong the dying process. And that is in part due to, a lot of clinical interventions and drugs, medicines, machines, things like that. And the emphasis tends to be more on, okay, what can we do? What can we do? What can we do? What can we do? And we're putting a lot of our a lot of the skills and the traditions and the knowledge that we used to have in supporting those who are death and dying, all that has kind of been outsourced now to medical professionals. They really are the guardians of, end of life, and it removes family and community involvement, and that is really detrimental. It removes us from this part of life. It removes us from the natural cycle of life and death. And death is kind of presented as this thing that needs to be beat, or, an enemy that cannot win. And so we look toward healthcare professionals as these heroes that, we want their help. They need to save us from death. And so, yeah, death is villainized, it's the enemy. And again, this all really contributes to our modern death care culture. And of course, there are organizations like this one, where, we're providing education, we're coming together in community, and death maybe is not seen as an enemy. But for the majority, I would say, of American people, like, death is just something that is so, so, so hard to even talk about. And this is where death doulas come in. I'll talk about that in a little bit. But as part of our modern death care culture, and as part of the systems that we've created to die in, it's not just the hospital system, right? There are still 20% of people who die at home, and usually those folks are under hospice care. And hospice is truly an amazing benefit. If you've ever had experience with someone on hospice, hopefully it was a good experience. There are, of course, limitations because it is, it's a branch of healthcare. And it's really the only model we have for standard end of life care at home in this country. There's only one model, which to me just seems kind of wild, supporting however many folks we have in this country, and there's one model. So, but it has amazing benefits, and I love the team and the organization that I work for. But again, it does have its limitations. So hospice care, just a little brief history about hospice. It really hasn't been around for that long. The concept of even specialized care for the dying wasn't introduced to the United States until the early 1960s, so Dame Cicely Saunders, if anyone has heard of her, she was a palliative care nurse in England, and she started St. Christopher's Hospital, which was a hospital for dying children. So she started the conversation about specialized end-of-life care here in this country. And kind of around the same time, that's when Elizabeth Kubler-Ross was doing her work on the 5 stages of grief, which has now kind of been reworked by a lot of different thought leaders and grief experts. The first ever hospice conference in the States was in 1975. And then hospice care was initiated in 16 states in 1979. And in Marin, Hospice by the Bay, I believe, was the 3rd hospice in the United States. So yeah, we have the pioneer not too far. And as of 2020, there are over 5,000 hospice agencies in the United States. So yeah, there's quite widespread access to hospice care. But again, it's the only really standard model that we have for end-of-life care in our country. And so hospice is care for folks who have a terminal illness and are expected to die within 6 months or less. We have patients who stay on hospice much longer than 6 months. And a lot of the time that's because their quality of life is so improved that their bodies are under less stress. They're so much more comfortable. They're at home. They're a lot more peaceful. And they actually live longer than they were expected to. People on hospice care can no longer be pursuing aggressive or curative treatments. So no chemo, no trial drugs, no more big surgeries. But really the goal of hospice is symptom management to promote the best quality of life. And they really are experts with symptom management. However, hospice comes at it mostly from a medication angle. So there's been a lot of research that shows that pain, for example, right? It's not just a physical response. There are a lot of layers to managing pain and why someone might be in pain. It's not only physical, it's emotional, it's mental, it's spiritual. And so when that's only, treated with a medication, there are so many other components of that pain that aren't being addressed. And when you're on hospice, when someone's on hospice, they have a team, they have a nurse, they have a social worker, they have a spiritual support counselor. And certainly the social worker and the spiritual support counselor can try to help address some of those spiritual and emotional components of pain or anxiety or even difficulty breathing. But the reality is, hospice clinicians have really high caseloads. When I was working as a case manager, I had anywhere from 12 to 16 patients And that's good. California is good to their nurses. In other parts of the country, these hospice nurses have like over 20 patients at the end of their lives to be taking care of, to be holding all those stories. And not only the patient, right, but their family members, their loved ones, or maybe they don't have anybody, and that is incredibly difficult. So, but yeah, in California, the nurses, 12 to 16 patients, social workers, around 20 or more, spiritual support counselors, 20 or more. So hospice clinicians are really stretched, and there's a high risk for burnout. And of course, that affects how care is delivered, and the level of presence that these clinicians can really offer to people at the end of their lives. And again, I think hospice is an incredible service, and I know a lot of people are really happy with the care that they receive from their teams. And it's just important to be mindful about the realities of the hospice system. You know, clinicians can only do so much. And also the reality is that people at the end of their lives deserve so much care and attention and support. I mean, this is like the biggest journey I think any of us will ever take. And so to only get a visit once a week from your hospice nurse or twice a week from your hospice nurse, sometimes social workers, you know, it's only a phone call. So yeah, there are some gaps, and I think this is where doulas really fill the gaps and help support hospice teams. I think when doulas and hospice teams work together, that is like the optimal support system for someone at the end of their life. Hospice can be, you can receive hospice wherever home is. So that can be at a private residence, that can be in assisted living, that can even be in a hospital. People can unenroll from hospice at any time. I think folks, there's a lot of, I've heard this where going on hospice is like a death sentence. Like people think like that's it. And yeah, that language is harsh, and it's also just kind of, I think, a misconception of hospice that, you know, once you're on it, it's like, that's it. Really, I mean, once you're on it, you can certainly unenroll at any time if you do decide, or your loved one decides that they want to pursue a more aggressive treatment, or, you know, try that clinical trial. They can certainly unenroll at any time, and it's a very easy process, actually. And hospice is a free benefit that's covered by Medicare. So that's a huge relief for a lot of people. There are certain medications that hospice won't cover, like if it's not related to comfort, but usually folks have, you know, another part of their insurance plan that will cover what hospice does not. And then people also wonder, so what's palliative care then? Palliative care is for people who have a life-limiting illness with any prognosis. So hospice is terminal diagnosis, expected to die within 6 months or less. Palliative is for life-limiting illness. So that can be something like, you know, heart disease, congestive heart failure. Maybe you've just first been diagnosed and you're starting to have some more symptoms, maybe that are requiring trips like to the emergency room a few times a year, which really all of that can be managed at home with the right medications and with the right oversight by a clinical team. So that's really where palliative care can be quite helpful for folks. And again, any prognosis, so it can be years. Folks on palliative care can also be simultaneously pursuing curative or aggressive treatment. So, for example, if someone's on chemotherapy, but they're experiencing a lot of nausea and dry mouth, palliative care can help treat those symptoms. And similarly to hospice, the emphasis is on quality of life and symptom management. And some insurances cover palliative care and some do not. But really the big difference here is that palliative care is a longer prognosis and the diagnosis does not need to be terminal. Okay, so those are kind of our modern death care, end of life systems. And as I said, this is the standard for end of life care in our country. And there's recently been kind of a surge of people interested in the death doula movement, interested in becoming death doulas. I think I read a statistic recently, I didn't write it down, but from like 2017 to 2020, within 3 years, one of the end of life doula organizations, NEDA, National End of Life Doula Association, they had their membership triple, and members have to be death doulas. So there's really been an increase in the amount of people out there who want to support people at the end of their lives, who want to help give people a different kind of death. And I think COVID was probably a really big reason why we've seen this surge of people wanting to change death care in our country, just wanting to give people a different way to die with more presence and love and support. So, what is a death doula? I have a couple definitions that I'll read, and then we'll just talk more about the role. But NEDA, the organization I just mentioned, defines a death doula as a trained individual who provides non-medical holistic support and comfort to the dying person and their family, which may include education and guidance, as well as emotional, spiritual, and practical care. So something really important to highlight here is that death doulas are non-medical. We are not clinical. We're not in a clinical role. Even if someone like me, I have a nursing license, or even like a licensed medical social worker, we in the death doula role cannot perform any clinical tasks. I want to read another definition that goes a little bit deeper and wider in terms of how death doulas are really trying to shift this narrative of death care in our culture. And this was by the Lancet Commission actually did this massive report. There's like this 40-page report on how we can change death care. I haven't read through all of it, I'm making my way through, but their definition is about the death doula movement. And they say death doula movement is an attempt to build skills and capacity relevant to death within communities. The movement challenges professionally led models of support for people dying, while acknowledging that many individuals or families do not have the skills or confidence to care for someone as they die. Navigating death systems can be difficult, and death doulas can challenge established norms such as where someone is allowed to die or be buried, or the role the family members can take in caring. So I love that definition because it touches on the fact that this is a movement, really to change the way that we support people at the end of their lives. And also just acknowledging that people do not have the skills and the confidence to care for someone as they die. I mean, I believe that we all have the intuitive knowledge and how to be present for someone, but it's just a matter of being empowered to do so and to know what's normal, um, and to know that dying is a very sacred part of life. And that's the other thing that death doulas, I think all of us would agree on, is that returning death to its sacred part of life is one of the most important things that we do in our work, and one of the most important visions that we have. So the word doula, maybe you've heard of a birth doula. So death doula is same thing, just for, the other end. A birth doula is someone who supports the birthing person before, during, and after death, and also their loved ones. So that's what a death doula does. They are present for the dying one and whoever's there with them before, during, and after death. And we provide education, we provide practical support, spiritual support, emotional support. There's no governing body for doulas, death doulas yet. So there's no such thing like as a certified death doula. There are organizations that kind of define the scope of practice for a death doula, and offer like directories for where you can find doulas in your area. And I mentioned one of them already, NEDA, N-E-D-A, that's the National End of Life Doula Alliance. And the other organization is INELDA, I-N-E-L-D-A, and that's the International End of Life Doula Alliance. So I imagine that in the future, we will see some kind of governing bodies for doulas, and kind of like a standard training. There's a lot of different trainings for death doulas. So I always tell people, if you're looking to hire a death doula, it's really important to interview them and just kind of get a feel for, of course, who they are, but also what their training program was like. And also, the fact that there is no governing body, it has pros and cons. I think one of the pros is that doulas can kind of bring in their own specialized, whatever their own professional background is, whatever their life experiences, whatever kind of other healing modalities that they've picked up along the way, they really kind of bring that into their own practice. So it's always good to talk with your death doula, or talk with multiple death doulas to see who aligns with your needs best. So as I said, doulas provide non-medical care. Even as a nurse, I am not allowed to give any medication as a doula. So the line is a little bit blurred, but that's the standard, that's the scope. With the exception of medical aid and dying medication. So for folks who are opting to pursue medical aid and dying, which is legal in California, as well as 11 other states now, I believe, death doulas can go through a specific training that allows them to be present for and assist with the medical aid and dying medication. They cannot help anyone ingest the medication, but they can handle it and prepare it if they go through this specific training. And really, with the death doula role, we're collaborating. We're not leading anything. We're not leading care. We're not directing care. We are collaborating with clients and with their families. We can also collaborate with their hospice team if they're under hospice care, and really just helping to educate them and empower them to make informed decisions at the end of their life, and to give them agency and autonomy. I think people forget, they get so overwhelmed by what's happening that they forget that they have choice and that they have agency and that they get to define what this experience looks like and feels like. I think a lot of times people at the end of their life, they feel so powerless and hopeless. And with a death doula, you know, we give them some of their power back. We give them, you know, their hope, and we do that through education, and we do that through spiritual and emotional support, and also physical care as well. Something I think it's important to also talk about some death doula misconceptions, just some things that I've heard or questions that I've been asked, just in some casual conversations around death doula work, because this is, you know, this is kind of like a new-ish, well, it's a very ancient role, but we're starting to see more doulas pop up here. So death doulas do not hasten death. We do not come in to speed up the process. We do not come in to deliver medications that will hasten death or end someone's life. Again, we are there to support dying ones and their family members, their loved ones, through this process. Death doulas do more than sit at the bedside. So I think a lot of people, this may come from how birth doulas function, where they're like in the room while the person is laboring. Death doulas certainly can be at the bedside during the active dying process, during the labor of death. But I know quite a few death doulas who do not, who will be there for parts of that, but they're not there, you know, 24/7, because that process can be anywhere from 1 to 5 or even more than 5 days. So to have someone be there 24/7, you know, for 5 days, that's not something I am aware that a lot of doulas offer, but they will be there for portions of that time. Really, our goal is to educate and empower families to be there at the bedside with their person. And I just want to be, when I say families, I mean that can be biological family, that can be chosen family. And if the dying person doesn't have anyone, then death doulas can certainly step in and be more present. Absolutely. But yeah, really, we want to be empowering that person's care system that's there to be at the bedside and to teach them how to be present with a dying person, and to teach them, you know, what's normal, what dying actually looks like in the physical sense, and how to respond as their person goes through that labor. Again, death doulas are not licensed professionals, so there's no governing body. So really important to talk to your death doula, talk to them about their experience. Another misconception, death doulas are not caretakers. I think it can be easy for death doulas to fall into like a caregiver role. And certainly when we're there, if the person has needs, and what I mean by caregiver is doing like kind of hospice aid or like CNA work, where they're doing, you know, incontinence care, bedbound care, or they're, you know, even outside of the dying person, they're picking up kids for the family, or they're doing grocery shopping, or, you know, support like that. If that is what the doula chooses to offer, that is great. But in general, as the expectation is not that that's what doulas do. And the other misconception is death doulas are not, they're not always present at the time of death, nor do they have to be. You know, some families don't, that's a really, really sacred time. And some families don't want anyone but their, you know, core there at the bedside at the time of death. And because death, of course, is unpredictable, you know, we can tell when it's getting closer, but we don't know the actual moment it's going to happen. So it's hard for death doulas to be able to say, yes, I will be there at the moment of death. So again, it's really all about educating and empowering the family, the care system that the dying one has, so that they feel confident to be with their person through this transition. So death doulas offer a lot of different services, and it is going to vary based on each unique doula. But I want to highlight 4 services: vigil planning, home funeral support, life review, and legacy project. And these are all really impactful ways that death doulas can transform the dying experience. Your kind of I don't want to say regular dying one, but dying people who pursue hospice care without a death doula, which is the majority, you know, they receive physical comfort, they get a little bit of extra emotional and spiritual support from like the social worker and the spiritual support counselor. But there's this whole world of support that exists outside of that system. And this world of support is what changes the death and dying experience, not just for the dying one, but also for the family members. And when the family and loved one witness that death can be different, like this has a ripple effect. And this is how we shift away from this, our current culture of death, where there's a lot of fear and resistance and, you know, just anxiety. This is how we change it. We change it by showing people that death can be, I mean, it's always going to be hard, and there will always be fear and anxiety, but it can be different. It can be sacred. It can be beautiful. And I think most people just don't know that. And so some of the ways that death doulas do that are through these services. Vigil planning. So vigil planning, or vigil, is the period of active dying that lasts anywhere from 1 to 5-ish days. It can be longer. And this is really where the dying one is kind of going in and out of consciousness, and we're starting to see some of these telltale symptoms that end of life is near. So changes in the breathing pattern. They're no longer getting out of bed. You know, they're starting to have visions of others who have died before them, you know, dead relatives, dead friends, even dead pets. They'll start to see them in the room. I've seen this happen so many times. Their gaze will start to become unfocused. So when you look at them, they're like looking through you. You know, they stop eating, they stop drinking. So these are all kind of the signs of imminent death. And when we meet with a client, ideally, you know, months before they're expected to die, we can sit with them and do vigil planning. And so we're talking to them about what they want this time to look like. Do they want certain music on? What do they want to see? What do they want in the room? Where do they want their bed set up? What sounds do they want to hear? Do they want certain candles or incense burning? Do they want poems read every night? Do they want scripture read? These are all sacred tasks. These are all ways that we can create ritual, and not only does it help make the dying experience sacred, but it also gives loved ones a sense of peace and grounding, knowing that they're carrying out their loved ones' wishes. So again, ideally we're doing this a few months before, but there are still ways, if we didn't get a chance to talk about this with the dying one and the death doula comes in, just a couple days before they die, there are still ways to make the vigil sacred. And again, you can even just lighting a candle at the same time every night and meditating together, can be something as simple as that. So it really is just about having a conversation with the person, understanding if they have any spiritual or cultural practices, and again, setting up a plan to make this a really sacred time. Death doulas can also offer home funeral support. Again, not all death doulas offer the same thing, but this is one thing that a lot of us do offer. And I think this kind of weirds people out sometimes to think about, keeping their deceased loved one in the home for extended period of time. But it truly is one of the most profound ways that we can change the way we relate to death. In my work as a hospice nurse, we get called when someone dies, like minutes after someone dies. We go to the home, we pronounce the time of death, and then call. A lot of times people want the mortuary of choice called right away. And the mortuary comes to pick up their loved one within like 60 to 90 minutes. I think that's really fast. People have just spent all of this time being with their loved one in this dying process, laboring with them through the end of their life, and then they're just gone in 60 minutes. And that period after death, that like quiet period, is such a potent opportunity to sit with death and to just kind of come down from the experience and to ground into what just unfolded. And I think when bodies get whisked away within an hour, that feeds into our death aversion and our death phobia, because we're not being with death in the ways that we can be, and I think in the ways that it wants us to be. So home funerals are legal in the United States. There are a couple organizations in the area, Final Passages in Sebastopol. They're an incredible resource for home funeral support. And really the vision for home funerals, the goal is to help educate and empower families to exercise their right of caring for their own dead. And doulas help to plan and guide, not direct the funeral. We're not funeral directors, but it's really, again, it's a conversation about who was this person who is dying, what would be meaningful for them and important for them to have their loved ones engaged in after they die. There's access to more time and privacy, and again, hands-on engagement, and that can really, it can result in a more meaningful experience, and it also might benefit the grieving process and our relationship with death. It's also much more affordable than a traditional funeral. I think a traditional funeral, if you do, you know, embalming and everything like that, it can, and then cemetery, paying for actual burial, it can be upwards of like $9 grand, $7 to $9 grand. So home funerals are a lot cheaper than that. You can purchase just cardboard. Doesn't need to be anything more than a cardboard box. There's opportunities to decorate the box. There's opportunities to shroud your loved one in, you know, a beautiful garment. I've heard of people hand dyeing shrouds, and, you know, there's just so what we can do with death, it's endless. It's endless. It just takes normalizing these conversations and really being present and being with our own hearts and feeling into, you know, what we want, what would our person want. Yeah. So home funeral support. Another really big thing that I would say most death doulas do is life review. This is like a huge thing that we do. I've also heard it called dignity therapy. But life review is this process of exploring questions about the dying person's life. These questions, the goal of these questions is to lead them toward more meaning and wisdom and peace. It can be a series of questions like an interview, or it can just unfold as a conversation. Henry Fusco Weiss, he wrote a book called Caring for the Dying, and he's also the executive director of INELDA, which is one of the doula organizations I mentioned earlier. But he wrote a book called Caring for the Dying, and I wrote down one of his quotes. The work of the doula is to guide a dying person to a place of engagement with their life experience, to open the door to understanding. Out of the crucible of that engagement will come an overall assessment that places the person on the side of integrity or despair. And this is the way that we help people move from that sense of despair and hopelessness and just deep, deep, deep fear toward peace and wholeness, ideally. And we do this by helping them look at their lives, look at those pivotal moments that change their lives, those relationships that change their lives, asking them, you know, who do you need to forgive? Do you need to forgive yourself? What are you ashamed of? What are you proud of? Just helping them look at their life as a story and allowing them to derive meaning and peace and purpose and wisdom, because that's what can help put them in this state of integrity as they make their final journey. I wanted to say something else about that. It will come to me. Life review is also closely tied to legacy work, which is another offering, I would say, that most death doulas offer. So a legacy projects are when a doula helps the client and loved ones come up with either like a physical object, usually a physical object or objects that represents who the person was and how they lived. It's what they leave behind. So it can be, you know, a cookbook or a scrapbook. It could be a series of letters. It could be a written story, the book of their life. It can get very creative, but if we think of like an archaeologist kind of digging up relics from an ancient civilization, we learn a lot about who people were, what their values were, how they lived, what were some of the big events. And these relics, it preserves their existence. And this is what someone's legacy project is. This is what that cookbook is. It preserves their existence. It teaches us, it shows us what their values were, what their passions were, how they loved, how they expressed themselves. It's kind of like this symbolic immortality, and it can offer the dying one a lot of peace, knowing that they won't be forgotten. That's actually one of the biggest fears that a lot of people have as they approach the end of their life, is that they will be forgotten. And helping someone come up with a legacy project, a legacy object, can really alleviate a lot of that fear. It also offers a lot of peace and connection for the family members, knowing that they're still going to have a piece of their loved one. And like I said, legacy project and life review kind of go hand in hand. So as a doula is collaborating with a client and kind of thinking of what would be a good legacy project, it often leads into life review. So if it is, that cookbook, for example, there's often a lot of story that comes along with these recipes. There's often a lot of family history that emerges when we're talking about life review and legacy. So they really do go hand in hand. And again, ideally, we're doing this a few months before someone dies. If there's not enough time, there are still ways that we can leave legacy. So if a doula comes in, again, a couple days before someone dies, having an altar set out with like a little box and some index cards where people can write stories on the index cards and place them in the box. That is a way to preserve that person's legacy. Those stories will always be there. And there's really something about having a physical object that makes a huge difference. There's a lot of power. There's a lot of love when we can touch something and smell something and look at the writing. See, yeah. And it's a sad reality that so many people die without ever having the opportunity to examine their life and really explore meaning in a deep way. And again, with hospice, they're doing so much and they're doing the best that they can, but I promise you, they do not have the time to work on a legacy project. And again, people just don't know what they don't know. But it makes me sad that so many people die without really having the opportunity to explore their life in this way. Many people don't even realize that it's possible for their legacy to be preserved and maintained after death. And this is a way that we can help people better understand themselves. And it's also an opportunity to model to others how we come to terms to death. And again, there's a ripple effect to doing all of these things. When we model to others that there's a different way to die, they will remember that. They will remember that deeply. And hopefully they'll want to approach their death in the same way. And it goes on and on and on. again, just to kind of, I feel like I've said this so many times, but hiring a death doula really does change the death and dying experience. It fills in the gaps and limitations of hospice care. And we're really just an added layer of support and time and presence. And we're an added layer that really makes the experience rich and deep and meaningful. There's a lot of knots that we have within us as human beings, and death doulas help people just untie those knots and kind of loosen up so they can be free. And in addition to that work, that's really the emotional and spiritual work, but practically death doulas provide a lot of support, a lot of resources. I didn't even talk about, we can help with advanced care directives. We can help with final arrangement, helping you plan final arrangements and helping you find caregivers, putting you in touch with other practitioners, healing practitioners, grief resources. And ultimately, we want to help shift the death care narrative. Death doula work is individual work, but it's activism. Like, really, there's like a deep passion that death doulas have to change the way we die. And I hope that in my lifetime, in our lifetime, we get to see that shift. Death doulas work in a few different capacities. Some do independent private pay work. Some death doulas are volunteers. There are death doula collectives that exist. So there'll be like 4 or 5 death doulas kind of all working under one umbrella. There's one in the East Bay called East Bay End of Life Doula Alliance, I believe. There's one up here in Marin. I forget what it's called. But yeah, there's collectives. Some doulas are employed or work in conjunction with hospice agencies. And then other doulas you'll see are more community educators doing classes like this, workshops, things like that. So again, Google, find your doulas. You can go on those 2 organizations I mentioned, NIDA and INELDA. They have directories of doulas by state. But again, not every doula is going to be listed on those websites because some have just chosen not to be members of an organization. So, looking at your community boards, in coffee shops where people post things, it really is kind of a grassroots movement. And of course, social media is a great place to find them as well. I also just wanted to highlight a couple organizations, one in North Carolina and one in Washington State, that were started by doulas who are doing really incredible work. And I just think it's neat to share what other people are doing. So in North Carolina, there's something called the Center for Conscious Living and Dying, CCLD. And it started because there was this young man, his name is Ethan Sisser. Maybe some of you have heard of him because there is a documentary about all this coming out very soon called The Last Ecstatic Days. But Ethan Sisser, he, I believe, was 36 or 37 when he died, but he had glioblastoma, so he had a brain tumor, and he documented his journey. It was the height of the pandemic when he was documenting his journey. And he was alone in, all these hospitals because it was the pandemic. And he was documenting his journey on, I believe it was TikTok, and just sharing everything with the world. And in one of his videos, he expressed the desire to die in community. Like, he didn't want to be alone. He wanted to die in a community of doulas and healers and energy workers. Before he was diagnosed, he was a big yogi, like very spiritual person. And he just wanted to be cared for by a community. And someone saw this in North Carolina, and a team of death doulas, volunteers, and a medical doctor gave him the death that he wanted. They transported him from whichever hospital he was in to this beautiful home in the Blue Ridge Mountains in North Carolina, and gave him the death that he wanted. He was surrounded by so much love. He was surrounded by music and energy healers. And I can't wait to watch this documentary. But from this experience, the Center for Conscious Living and Dying was born. So they are still located at that same house where Ethan died. And they are now a community resource for education and workshops. And they have the capacity, I believe, for 3 patients to have that same kind of death that Ethan had, to be cared for. It's a non-medical setting. It's all community-based death care. And this is really the direction that, I think we should be moving in terms of death care, to this community-based work. It takes a lot of work to care for a dying person. It is around the clock work, and it is spiritual, and it is emotional, it is physical for everybody involved. And to expect that only 1 or 2 people can manage this, I mean, sure, we do it, right? But is that the most meaningful and fulfilling way to engage with this part of life? So this is a really, really special place. And just one of the ways that death doulas are establishing themselves in communities. The other place, I saw something in the chat come up about the place in Washington. So it's called a Sacred Passing. And this is a doula, not a doula collective, but it was started by an EMT, actually, but is now run by a lot of different doulas who also have like social work background. There's lots of volunteers here. A Sacred Passing has a lot of different offerings, but one of the really special ones that I wanted to highlight was they have this program called A Place to Die. And they give folks who feel like they don't have a safe place to die, who they're usually pursuing medical aid in dying, or VSED, which is voluntary stopping eating and drinking. So for these folks who don't feel like they have a safe place to do that, or if they're in a facility that will not allow these types of options based on religious reasons, or because they're afraid to have someone die like that in their facility, which is a thing, a Sacred Passing will give these folks a place to die. And they also invite people from the local community to open up, if they have an extra room in their house or an area in their home where they would want to open it up to someone who's dying. There's an opportunity for people in the community to offer up their space. And I just think that's very special. So there's a lot of good work being done by doulas in the country. And these are just a couple that I highlighted. But again, death doulas really are passionate about changing the way that we die in this country. And I think the fact that it's a non-medical role it says so much about what the dying process actually is. You know, the dying is a human event. It is not a medical event. There are medical needs at times, but more than anything, dying is a human event. And so what we need is not another clinical intervention. What we need is human support and care and love and compassion. And, you know, death doulas are not the only ones who can offer that. You know, family members, loved ones, we're all there to offer that. And if there's any fear, any anxiety, death doulas help people with that. We help empower people so that they can be present with their love and their compassion. And working with a death doula just offers an opportunity for a lot more peace and wholeness and integrity at the end of life. I think I'll pause there because it looks like we have some questions.
Please address the very common concern that hospice care typically uses morphine and other drugs and tend to over-medicate patients when they would prefer to remain more lucid. That said, we are taught by our Buddhist teachers that dying in pain is a distraction for the consciousness. This aspect of transition is a particular concern of Buddhist practitioners who wish to die in a lucid state of mind.
Yeah, that is a common concern among a lot of people. Thank you for that question. Yeah, it is a really, really, really fine balance between treating someone's pain with morphine. We also treat difficulty breathing with morphine. It's a fine balance between treating that pain and making sure someone is comfortable with not over sedating them. The reality is some people have such high amounts of pain that the level of morphine that they need to be comfortable is going to cause sedation. And I'll just speak from some of the experiences that I've had with people who express this concern. They just, they haven't wanted to be sedated because they still want to engage with their family or their grandchildren. You know, they don't want to be sleeping all day. And we'll titrate, you know, we'll start cutting back on the morphine to give them more energy or to give them more alertness. And they find themselves, they're just in a lot of pain. So it really is a fine balance. I mean, I think there are probably some instances where in hospice they are over medicated and they are over sedated. I want to believe that hospice clinicians are not purposefully over sedating their patients. I'm sure that happens sometimes, but it really is a fine balance. I think also making sure that, you know, the spiritual and emotional components of pain are also being addressed as well. Because like I said, pain is a multi-layered phenomenon. So spending time on the emotional and spiritual components that might be contributing to increased pain is really important. And again, hospice often doesn't have the time to do that. So that's kind of my perspective. I know from a Buddhist perspective, I don't know, Julie, if you have anything to add to that.
Well, I could say just from the many teachings we've had here at TLC over the last years, this points to the importance of really deeply practicing when you are not ill,
Mm.
and to develop confidence in your practice and in your Buddhist teacher. Because once the consciousness leaves the body, it is completely aware the moment it leaves the body. And if you are confident in your practice and relaxed as you pass, the ability to engage in practice after death becomes available. And I've heard many teachers say that it is much better to have sedation at the worst, but it definitely have help with drugs in order to avoid extreme pain, because the consciousness is so distracted by the pain that it's hard to focus at all. And that once the consciousness leaves the body, the drugs have no effect. So if you've accomplished your practice or have at least some stability in your practice before you pass, before you're ill, you will do much, much better during the transition. So the next question is, have you used homeopathy for the dying?
I have not. No, no, I have not. Um, I'm trying to think if I know any doulas who do. Um, Do you mean, I don't know who asked that question, but in terms of, yeah, homeopathy for symptom management?
We can come back to this question.
Yeah.
If the person who asked it would like to go back into the chat box and direct your continuance of this question to me, and I'll read it out loud. The next question is it true in the state of California and perhaps others that the body can remain in the home for 3 or more days? Is it also true that bodies are typically removed from hospital beds within a half an hour? This difference in timing has an impact on spiritual practices that can potentially be engaged in at bedside, as well as the possibility for some aspect of closure.
Mm, yes, you are so right about that. You were right about all those things. Yes, you can keep, in California, it's legal to keep the body in the home for more than 3 days. There really is no one that regulates that. And then within the hospital, yes, bodies are removed very, very quickly and they go straight down to the morgue in the hospital. And it absolutely impacts this sense of closure and the sense of processing and the opportunity to have spiritual practice. So again, that's another reason, to, if we can avoid it at all costs, avoid dying in the hospital. It's just, some hospitals are good about allowing the room to be infused with, some belongings from home, or allowing family to create ritual. A lot of times they'll try to put you into a private room so you can have that space. But as far as like post-mortem ritual and care, you're not really allowed much time in the hospital.
Okay, back to the previous question. Yes, the question was about homeopathic management for the dying.
Yeah, that's really interesting. I do not, but I'm curious now to learn more about what some of those tinctures and things that can be used for the dying. Yeah.
Okay, the next question is, who pays for the doula services and what is an average price range?
Good question. So doulas are private pay. So death doulas are not covered by insurance at this time. Hopefully that will change in the future, because I know some death doulas, some birth doulas are covered by insurance. So right now it is out-of-pocket private pay. And the cost of doula, some charge by the hour, some do like package fees. But I would say in this area, probably anywhere from 80 to, I don't know, maybe like 150 an hour. That might be a little high, but I would say, yeah, probably 80-ish an hour. It varies. Each doula can set their own pricing based on their experience and their offerings. Yeah. And some are volunteers. Some you can find community volunteers who do it for no cost.
How long is doula training, and is it expensive?
Again, it varies. There are some really kind of more robust trainings, like the Conscious Dying Institute in Colorado out of Boulder. They have a pretty robust training program that there's a self-paced option. There's also in person. I believe that's like a 6-month program. Actually, they don't do a self-paced. Sorry, that was not true. But their sacred doula program is around 6 months. And that's a really engaging program. You're working with people virtually like this. And then there are other programs, and that's in the like $thousands. And then there's other programs that are self-paced that you can do within a few months that are maybe in like the hundreds of dollars. Yeah, there's the Conscious Dying Institute that does one. Going with Grace is another good one. Death Wives, they have one. There's really a lot. I mean, if you pulled up a Google search, you know, it would reveal a lot of different options. So again, it's just a matter of going to that website and reading about the doula, reading about the training and what they're going to be covering. But the Conscious Dying Institute, yeah, that one's, I would say, the most robust program that I've come across. And they also do a conscious dying coach. So they teach people, they give kind of like a more practical framework for how to help someone. That like life review that we talked about, it's kind of their version of that, but it's more of like a structured framework. So they have the Conscious Dying coach and the sacred doula.
At what point in the illness and dying process should one contact a doula?
I love that question. As early as possible, definitely. I would say at diagnosis, and doesn't even have to be terminal yet, but any life-limiting diagnosis where death is expected, and it could even be a year or two, and you can be working with a death doula, again, because there's so much that we can talk about. There's so much that we can uncover and work through. And to really, the earlier the better, because your state of mind, if death is like 3 months away and you work with a death doula, your experience of doing these things like vigil planning and life review and a legacy project, that's going to look a lot different than it might if you have a whole 6 months or a year to work on these things. So I would say the earlier the better, for sure.
Can you address support for bereavement?
Yeah. Yeah, so some doulas are also very well trained in grief support. Um, and some doulas will offer extended grief support as part of their offerings. For me and what I offer as a doula, I refer out for grief work. I just think grief work is a whole different arena that requires a lot of good training, and I haven't been trained to hold grieving people, I think, in the way that they need. I mean, there is a big component of grief work in, you know, in sitting with someone who's dying. There's a lot of anticipatory grief they're leaving behind. There's a lot of grief work that we do, but in terms of supporting bereaved families, I would refer out to I have a couple programs and then some individual grief workers that I know that I would recommend.
Okay, and does a death doula work closely with the family and close friends who are present to help them with the communication process? This can be difficult, especially in families who are unaccustomed to talking personally.
Mm-hmm. Yeah, so helping family members and loved ones communicate with one another, I think is what I understood from that question. Yeah, absolutely. I mean, I think up to a certain point, if it's really, really challenging, maybe a mediator could be helpful, but definitely to a certain point, helping families, helping facilitate those conversations and making sure that everyone is heard. Absolutely. Because one of the most important things in being at the bedside for someone is to be united, is to have the same, is to be on the same page. And it's really common for family members to, have disagreements or not feel comfortable having these conversations, or to know even how to approach these conversations with one another. It's really common. So yes, a doula can help with that.
Please describe your doula training. If you already did, please excuse the question.
I didn't describe my doula training yet, no. So I did Going with Grace, Alua Arthur. She's a pretty well-known death doula. She's kind of given death doulas a lot of visibility. She's had a TED Talk too, if you want to look up her TED Talk. Alua Arthur, Alua. That's how you spell her first name. But I did her self-paced program, and it was great. It was really thorough. It helped. I had a lot of experience with end of life through being a hospice nurse. So a lot of my education on what actual dying looks like, and understanding the system and medications and all that, I got a lot of that from hospice. But the death doula training was really helpful for me in terms of learning about these things like life review and legacy projects, and how to keep a body at home, care of a body at home, things like that. So it was a great training program for me. And then I've also am training in Hakomi therapy, which is mindfulness based therapy, which is very helpful, I think, for these emotional and spiritual conversations. And it's also really supportive for life review and helping people to find meaning in their lives, and to do that from a place of mindfulness is very helpful.
Are there death doulas in every state? Do they help with guidance on local laws about how to handle bodies, etc.? I imagine every state is different.
Yes, you are right. Every state is different, very different. And yes, I don't know 100% certain that there are death doulas in every state, but I would put money on yes, there are. And yes, your death doulas are the local experts on funeral laws, laws on keeping the body at home, even though there are no necessarily laws for that. Well, not in California, I guess in other states, maybe there are laws for that, but yes, they're your experts for regulations.
Are there death doulas in California who are also Tibetan Buddhist practitioners?
I bet there's one. Actually, yes, I do know of the one. I think I've spoken with Julie about her. She's the POA, she does the POA practice up here is she in Sebastopol? I'll send over the name. You want to send that out to your community. Yeah.
Yes, thank you.
Yeah.
I remember you mentioning this. Yes.
Yeah, yeah.
And we have one more question that I think you could spend probably the rest of our time on. And I'm also curious about it. Can you talk about some of your favorite rituals that you've helped people with during the vigil days?
Yeah. I can think of one patient in particular, and I've not done anything too ornate yet. I haven't had any families who want to do anything too kind of weird or woo-woo. But one of the things that we did for this patient in San Francisco was photos were really important to her. And we got one of these, they're like these electronic kind of iPad looking things where you can just have different photos that her family from all over the country could upload these photos to this iPad, and it was just there on her bedside. And there were constantly just photos cycling through, and there'd be new ones popping up because her family would just spontaneously upload these new pictures. And I remember one of the visits was just me sitting there with her. I guess this is more kind of like life review. But just we were just sitting together, and she would just share stories of all these new photos that would come up. And that was really special to be a part of. We also always had, fresh flowers in her room. I've never done this with a patient, or a client, but I really want to, where you bring seedlings of a plant into a room. And as the individual is dying, you're also observing this like new growth of a plant. And I just think that would be such a beautiful way to represent and just symbolize these cycles of life. I think that's a really good thing also for kids to see too. So that's something I would like to do. But just fresh flowers, candles, photos for her. She loved her feet rubbed with oils. So like I said, nothing, ornate, but it's just these extra touches of care on a daily basis. Yeah, that really changed her experience.
And we have one more question. Oh, they keep coming in now. Please talk about needing ice after the person has passed. I hate being cold and would like not to have to be put on ice while lying.
Yeah. I'm sure Julie and I can we can collaborate on this question or answer. Yeah, I mean, for the first day or so, you probably don't really need ice. If you keep the windows open, if you keep the room cool, you don't need ice right away. I would say probably by day, I don't know, what do you think? By day 3, you would want to have someone on, unless you're in a really hot area. If you can somehow keep the room cool with windows open, you wouldn't need it right away.
My experience has been that we always use ice.
Yeah.
Even in the winter, because if the body is laying in state in the home, you do not want aromas because the body starts to decompose immediately.
Mm-hmm.
So even though, for instance, my own husband, who died in January, he was in our bed when he died, and we covered the heater vent, opened the windows, so the room remained cool. But you also have people coming in to pray and to sit. And so we don't want it to be freezing cold. And so you can gently pack ice around the body. Cube ice in double bags works just fine. Blue ice is not necessary. But the other thing about this question is that after you pass, most people's consciousness leaves the body fairly immediately, unless you're some kind of practitioner, spiritual, and you're actually engaging in spiritual practice before the consciousness leaves the body, and that does happen. And so the fear of being cold is really not a concern, because the body at that point is a husk. It's like, you've just moved out of your rental and now it's an empty house. So there's really no worry about discomfort or these kinds of ideas. These conceptions are no longer a concern. So that's what I would say about that. But yeah, we've used ice no matter what time of year, because depending on the weather, of course, and depending on the state the person's in when they're dying, if they've been ill for some time and their body has really cleared out and they don't have a lot left on their bones, you're going to have less aroma. But if the person is fairly robust and decomposition begins, you're going to have aroma, and you don't really want to have that in your home when you have relatives, friends, loved ones coming in, or if you're doing home services, which is really common in Buddhism. That's the reason to keep the body at home. One of the reasons is to be able to do practices with the body or near the body. So that's something to consider. Then we have another question here. Did you do the feet rubbing or direct someone else to do it? I'm not sure where that came from.
I think from the ritual, that woman that I was describing. So I did it a couple times, but she had a really, really beautiful family. And they were very involved. They were very hands-on. And it's just like, a little carrier oil with some essential oil and just super light. But no, her family was able to do it as well.
Can I add something to that?
Sure.
In Buddhist tradition, in Vajrayana Buddhist tradition, when someone is nearing the end of their life, you do not want to touch their feet, because you want to direct the consciousness to the top of the head. And during POA practice or otherwise, you want to make sure that consciousness is not distracted. And typically, you're not to be touching the person at all. But if you do, it would be something reserved for touching the top of the head and the fontanelle, where the consciousness will hopefully leave the body. There are many teachings on this, but I just wanted to mention it. It's not a matter of neglecting or being uncompassionate or unloving toward the person who's dying, but when they're really close, you do not want to touch their body. It's much more helpful to do prayer and practice. So,
Yeah, and again, so important to, and she was not a practicing Buddhist.
Yeah, it just depends on the person.
But
This is really
totally.
particular. Yeah.
Yeah, so important to check in about spiritual practices, absolutely. And always, letting the client lead. I'm never like, I have to rub your feet, or it's always a collaborative, client-led effort.
And here's another question that probably I could say something about. Lama Tarchin's community in Santa Cruz, Pema Olso Ling, was taught POA. I don't know if the community offers that service, but I think it would be possible. And then a question about what services and support that TLC offers. Well, if you go to our website, everything that you could imagine that we do is there. And in terms of POA, we're hoping to have a POA retreat I don't know when this is going to happen, hopefully by next year. So, hosting a POA retreat with a Buddhist master. However, there are already videos in our TLC rental videos page that address the POA practice, and you would need an empowerment of either Amitabha or Chenrezig empowerment, but there are wonderful teachings with Jagdu Kadro, who is a POA master, that are available for rental very, very inexpensively on our website. And there's also a listing of books, recommended books, which include books on POA, but you would need an empowerment and teachings in order to do this practice, which is very accessible. It's one of the more, I think, in my feeling, a simple practice in Vajrayana Buddhism. So that is available. Are there any other questions before we finish up? Seems like we're at this completion stage. I am so glad that you were able to be with us today. Thank you so much. This has been this is like eating a really wonderful, filling, and satisfying meal of information.
Well, it was so great to be here, and I'm very grateful for the opportunity, and also just grateful to all of you here who took the time to gather and just be here together and to listen to these just listen to these thoughts and really this exciting and profound work that doulas are doing. And Julie, just thank you for sharing this platform, and I feel so grateful to know and trust TLC as a resource for end-of-life care, and y'all are doing such great work in the community, and giving so many different voices a platform to share their knowledge and expertise. So
thank you.
yeah, very grateful.